Hi everybody. Today we're going to talk about tennis elbow, also known as lateral epicondylitis. Right here is where you'll be feeling localized discomfort. Now some people feel it more here as well, and we term this the extensor wad. The muscles that extend your fingers and your wrist all attach here. This is called the common extensor tendon. So that's why when we often recommend a tennis elbow brace, or sometimes therapists will do kinesiotaping as well, what that does is it tricks the brain into thinking that all of these muscles and tendons attach here rather than here. And that allows this part to relax and rest. Now, just like any other itis, tennis elbow is an itis of these muscles here, an inflammatory condition. So that's why icing 3 times a day, especially after use, is always helpful, as well as doing some localized massage here. So today I'm going to teach you just a couple of stretches. Okay, so one of my favorite stretches for tennis elbow is to relax your shoulder, bend your wrist, and to take your opposite ear towards your opposite shoulder like this. And hold it for 7 or 8 seconds. And then release. And you could do that stretch 2 or 3 times. Now, stretching is not enough to ease the pain or to prevent the pain from coming on in the first place. It never is. Once the pain begins, it's very hard to get rid of. So preventative care is always best. Now, when I work with people with tennis elbows, there's certain patterns that I see in pretty much everybody. The first one, and I'd say, maybe 80% of my clients who have tennis elbow are predisposed to working with their arms far away. So that means, and some of them have actually very long bones, like their forearm bones or their humerus bones are longer than normal. And so what that means is then when they go to type, their arms are out here. Ideally, you want your elbows to be just to the front of your torso when you're doing, especially when you're doing computer work. Sometimes if you're doing work with a lot of vibration, like working drills or doing construction kind of jobs, then that also tends to give you inflammatory conditions throughout your arms, like tendinitis is sometimes very common tennis elbow as well. But the biggest, I'd say, red flag or pattern that I see that's often missed in therapists, both occupational and physical therapists, when treating tennis elbow or lateral epicondylitis is the component of how the distal musculature connects with the proximal musculature. So what that means is that the arms are not as well connected to the torso and the back as they could be. Oftentimes the person has a stiff back, and so when they go to reach for a glass of orange juice, the vertebra of their back don't move as well as they could. If you watch how a 5-year-old child moves and as he reaches for the refrigerator for a glass of milk, all the vertebrae turn. So a great way to retrain yourself into better organization of the whole musculoskeletal system is through Feldenkrais. Most all of my videos here on YouTube, or my products, my book, and my videos that I sell, all help you to reorganize your nervous system at a subcortical level. That means at an unconscious level. We all know what it's like when someone says, okay, move from your pelvis, like maybe you do martial arts, or maybe you do Pilates, and they say, move from here, blah, blah, blah. But we all know that as soon as we go back to doing our activities of daily living or back to our work, we forget how to move, and we move in the way which we're most habituated to moving, okay? So that's why it's important to learn at a subcortical or an unconscious level. The other big red flag that I see in people with tennis elbow is that they overextend their fingers. But ideally, when you're working at the keyboard or anywhere else, you want to maintain the neutral or the C shape of all of the fingers. So in order to find, the easiest way to find your neutral position of your hand is just simply let let it relax in standing. There's 3 joints to every finger, and each of the joints bends just a little bit, including the thumb also has 3 joints. The 3rd one is right here. Okay? So oftentimes what happens is when people go to the computer, they straighten their fingers. That's a big no-no. When you straighten the fingers, this overworks the muscles on the back side of your arm, creating the tendency to constrict your muscles all the way up to your neck. So oftentimes when we have tennis elbow, we also have a tight upper trap and neck region. So I'd like to invite you to watch any of my other videos which teaches you how to better use your body. And I have a newly released book out, just out, fresh, hot off the press this month. And it's called A Quick Guide to Easing Pain in the Workplace and Beyond. It's available on Amazon in hard copy or Kindle. And it's got 2 different book covers, so don't get confused when you go to Amazon. But we'll leave the link below. And I also offer company presentations. It's a great way to learn how to use the body more efficiently, to increase the overall productivity of your entire company, and to avoid overuse injuries. Thank you very much for your time, and I'll see you next time.